Telehealth is sponsored by Goshen Health.
The old-fashioned doctor's house call is mostly a thing of the past, but the ability for patients to get treatment or consultation without leaving their homes is now available using technology.
WSBT-22's Bob Montgomery reports for some patients in one local health system, this is being done at no cost.
Josie DeHaven runs the Goshen Health Telehealth system. It's for patients who need continual care but can't make it to the doctor every day. They're given the necessary equipment and training to have that ongoing monitoring and counseling.
We have patients that have a hard time getting out of their house. We have patients that, for lack of transportation, they're socially isolated, or they just can't breathe, and it's really hard for them to leave. So in this way, we're bringing care to them.
Please turn on the oximeter and put it on your middle finger.
And that care is more than just physical. It's also the mental and emotional support needed. DeHaven says a nurse sets up each patient with the equipment needed to have a video conference with them every day, along with the equipment that sends vital statistics along. This gives the caregiver a chance to really know the patient and the patient to know himself.
So we've been able to say, hey, you're still struggling with smoking. Why don't I bring my friend who's a smoking cessation counselor on video with you? And we'll have a conversation and they can help you think through what would it mean to stop smoking? How would I do that? What are the resources?
The patients in this telehealth system have no cost related to the service or the equipment. The money behind this program comes from the Goshen Health Foundation. Its director says this approach of communities finding more of their own solutions will play a greater role as the nation faces its healthcare dilemma.
What will shift over the next decade is a focus on outcomes rather than services. So we get sick, go to the hospital, pay for that service. Where I think there's a lot more interest in paying for outcomes rather than a fee for service.
Now, because of the constant communication between the patient, the doctor, or the nurse, many of these patients now recognize when they're in trouble, when they need additional help, and how they can better help themselves. There are about 36 patients currently in Goshen Health's telehealth system, with the program expanding soon to include cardiac patients. For Eye on Health, Bob Montgomery, WSBT 20.